Hi, this is again Dr. Ejaz here from MF Super Speciality Dental Care. Hope to see you all fine. We will discuss now something on the wisdom teeth, which is very important, and what used to happen about 15 years back or 20 years back. Now that used to be the wisdom teeth problem probably in 40 years plus or 50 years plus or 60, even 60 years plus. Now the present generation has a problem even at the age of 18 plus. So this plays a very important and significant aspect in the oral cavity or in the mouth, that whether this needs to be removed or not. As we have discussed in our earlier videos, we have mentioned that wisdom teeth has 0% in chewing. That means, that doesn't mean that 0% does not help you. Yes, as far as chewing is concerned, it does not help you in chewing. Now, what does it help in? It helps you in something called as stem cell therapy. Now, what is this stem cell therapy? This is, stem cells are something, they are like different names, totipotent, pluripotent and so on. Those are the stem cells. These are adult stem cells we are talking about. Okay, totipotent, pluripotent is present in an infancy or when the baby is in the mother's womb. Now, this is something in the adults, that is wisdom teeth. We are not talking more on stem cells. Maybe in the next video or in the coming videos, we will be talking on the significance of stem cells. Okay. Now, coming back to the wisdom teeth, this could be anything, like it could be below the bone or below the gums. Okay. Or it could be a little twisted away, as you can see in this, or it could be even horizontal like this, if you see very carefully. So it is something very much submerged. This kind of thing is very complicated. It has to be done in a minor surgical hospital operation theater. Okay, so it is a minor surgical procedure. Only if it is giving you kind of problems. What is that problems? That we will come to know, and we will tell you. Problems are nothing but your symptoms. Now, what symptoms? Symptoms could be pain, sensitivity, swelling, it could be bleeding, and finally referred pain. Now, this referred pain could be anything. We will give you separate video on referred pain itself. Now, that's very more significant. Now, coming back to this, so it could be either straight, it could be angulated, tilted backwards or frontwards, or it could be visible for the patient in the mouth. It may not be visible also. So, what is its significance? Is it helpful in chewing? As I said, definitely it doesn't help in chewing. It's 0% in chewing. What are the rest of the percentage, 100%? We have, please look into our other videos into the percentage of chewing of the teeth. That is in the adult. Okay. Now, coming back to this, how we do it, we have a different procedures. Most of the clinics, they do in a conventional method. We have, apart from conventional method, there is something called as laser method, and there is another newest method is magnetic mallet. Okay. Now, lasers, as you all know, was introduced by me, particularly hard tissue lasers from BioLase, way back in 2011-12. So it's been almost 15 years, 1.5 decade that laser was introduced. Now, we have introduced something called as magnetic mallet. You can go and see the details, and we have also given the video on the magnetic mallet as well. So we have 3 different options in our center, and one can ask more details, look into videos, or you can come and contact us or even message us. So we will be happy to help you out. And we thank all our Google Reviews patients who have been coming to us and giving us the reviews. So we have been having this kind of 3 different, and we give you options with all these things. For example, conventional, you can go to any clinic, you have it. So it's all done by conventional instruments or flow forceps or elevators. Whereas in lasers, we use it in socket healing, we use it in incision, we use it in something called as triple LT, that is low level laser therapy. So we use at 3 different stages in the wisdom tooth removal with 3 different techniques. Okay. Now, coming back to magnetic mallet, it's a different machine. Here we use it for easy elevation or non-invasive procedure of elevating your tooth from the socket. So this is what is all about your wisdom teeth. Thank you.